Well, Portugal has the highest number of coronavirus cases in relation to its population. And a sharp rise in new infections has prompted several European countries to offer help. Germany is sending doctors, nurses, ventilators, and hospital beds on a military plane due to land in the next hour. Portugal's ambassador says that the country will be forever grateful for the aid. Portugal has reported close to half of all its COVID-19 deaths in just the past month. And let's bring in DW's Jan-Philipp Schultz, who is joining us from the airport in Lisbon right now. Jan-Philipp, how important is this help?
It's urgently needed. Most intensive care units are full here in Portugal. Sometimes patients have to wait for 6-7 hours in the ambulances in front of the hospitals. I spoke to an ambulance driver last night, and she said the situation is really a nightmare, and any kind of help is appreciated. Human resources, medical equipment, everything. I also talked to other medical professionals who say that the situation starts to remind them of what we saw in Bergamo in northern Italy at the beginning of the pandemic in March, when really the health system pretty much collapsed and was overwhelmed by the pressure.
Why does Portugal have, one of the highest death rates in the past 2 weeks around the world? Why has it been hit so hard?
It seems like it's been something like a perfect storm evolving here in Portugal. The Portuguese government relaxed restrictions during Christmas time, and this was exactly the time when the new, more aggressive strains of the virus started to spread in the country. Portugal has close links with the UK, so the British variant has spread here at a rapid speed. Also, the Portuguese health system is quite weak, one of the weakest in Europe, especially after massive cost cuts in the past years.
How are people coping with the third wave?
There's an impressive wave of solidarity here in the country. I've seen many small projects, small initiatives in the past days when people try to help medical staff, they try to help relatives of the victims. Generally, I also think that the Portuguese really follow the measures put in place by the government. There are some critical voices that there are still too much traffic on the streets, considering that we are in a complete lockdown here. Of course, there's a great amount of fear that the worst is still to come here and that the crisis is far from over.
DW's Jan-Philipp Schultz in Lisbon. Thank you. Well, Israel has vaccinated a greater percentage of its population than any other country, but the number of new infections is still high, and the cabinet is set to convene today to decide whether to extend the lockdown. Authorities say that they are determined to contain the spread of the disease while immunizing as many people as possible. As DW's Tania Krämer reports, senior citizens are among those suffering the most from the pandemic.
It's been a long, rather lonely year for Ruth Rogers. Since the outbreak of the coronavirus pandemic last year, the 88-year-old Israeli American has been mostly confined to her flat. The internet has been her main source of contact with family and friends. But now she has new hope. A week ago, she received her second vaccine shot.
They say 2 weeks after the second vaccine, so maybe you can come and visit me.
I'm very excited about seeing people in person. I'm really excited about it. It's really been hard not to see people.
It's a step forward, but she's still very cautious. A large majority of Israel's most vulnerable population over 70 has received their second vaccine shot. A so-called green passport confirms the vaccination. But for now, that doesn't mean any extra privileges. While Israel's rapid vaccination drive made headlines, the country had to extend its lockdown once again to tackle a third wave of the pandemic.
The disease is rampant, and as you know, we have the variants, the South African variant, and we have the Los Angeles variant and the British variant, which is the dominant currently. The disease is spreading pretty quickly, yet the vaccines are spreading quickly as well, and we are racing the virus with the vaccine.
At the Itzhak Shamir Medical Center, a large hospital in the center of the country, doctors and nurses work tirelessly to cope with the constant flow of patients in serious condition. January has been the deadliest month yet of the pandemic. All of us, my colleagues, doctors and nurses, see a lot of cases here. Critical cases, and at younger ages. A few hundred meters from the COVID-19 ward, it's mostly young people waiting for their vaccination. Last week, people over 35 were called up to get their first jab. Over 3 million out of Israel's 9 million citizens have received at least their first vaccine dose. In Jerusalem, Ruth Rogers and her caregiver Mary are on their way to a local shopping center. What might seem ordinary has become special. Ruth hasn't been here since March last year.
It's strange. It's very strange. It's very strange. I hope in a couple of weeks I'll go into the store and pick out stuff. And now it's a whole different experience for me now. I feel back to the real world.
Amid the uncertainty, she hopes that at some point she will be able to see family and friends once the effects of the vaccination drive kick in.